Congressman.
Sure.
But who says that other than Paul Ryan? Why are you confident that you can say that system will actually cost less money than the current?
First of all, this is a system we can very much quantify.
Right.
We know exactly how many people are in this country. We know how much this is going to cost. We know how much the increase is going to be. And so we can actually quantify what it's going to cost taxpayers and the government, as opposed to the current government entitlement system.
Right.
Our entitlement system is an open-ended system. We don't really know how much Medicaid is going to cost.
And there's been some scoring of this.
Yeah.
And this is cheaper.
Yes.
And who did the scoring?
This bill has been scored by a number of scoring agencies, depending on the issue, whether it's been scored by all the traditional scorekeepers, CMS, which is Medicare, Social Security, the CBO, OMB. We have used all traditional scorekeeping to show, this particular plan was scored by the Treasury Department, to show that you can actually save more money in the long run by going down this path. And the reforms we're saying is, let's not have a government-run system. Let's have a system where everybody has universal access to affordable health insurance, but let's do it in such a way that we have real competition in healthcare, where healthcare competes like the rest of the American economy, and we can actually get people affordable health insurance without turning everything over to the government and creating yet another open-ended entitlement program.
So the refundable tax credit was scored by the Department of the Treasury?
Yes.
Okay. There's something in your report I found was a very interesting statistic. I may not remember precisely the numbers, but to the effect that the wages of physicians in the United States actually went down over the last decade in real terms, even though you had a 6.7% annual inflation rate in healthcare costs.
That's right.
So Americans in real terms are paying more for healthcare, but doctors are getting compensated in real terms less. I think intuitively most people find that odd. Who is making the money?
What's happening is the doctor and the patient are getting pushed to the margins of healthcare. Let me give you an example. In Milwaukee, Wisconsin, the price of a bypass surgery ranges from $48,000 to $100,000. The price of an MRI ranges from $600 to $5,000. On and on and on, a huge 300% price disparity. That money is getting sucked up in the middle. It's getting sucked up by providers, by hospitals, by those who are setting the prices. And so that is where all that money is getting sucked up. And the doctors don't see it, the patient doesn't see it, we see it through higher healthcare prices. What we know is that there is about a 300% price disparity in prices just in the Milwaukee community. You take that around the country, enormous price differences. Why is that? One hospital in Milwaukee marked up a price of a hip. The hip they buy to put a person's artificial hip, they bought it for $15,000. They marked up the device to $65,000 and billed the insurance company. There is so much price inflation in this third-party payment system, and no one knows where all this money goes. It goes to providers, it goes to manufacturers. And our point is, let's have total transparency so you see where the money is going, and so we have real price competition in healthcare. We have no price competition in healthcare. And if you simply have the government run the system, that's what created this problem in the first place.
Right now you have big corporations and big government doing well,
it's doing very well,
patients doing poorly.
Exactly. So what we want to do is put in the nucleus of the healthcare system the patient and the doctor so that they drive the system, not the other way around.
Congressman, I asked you a political question about Senator Obama and if he were to be elected and to actually put in place a national health care plan, the effect of that. Let me ask you another political question about the Republican nominee. John McCain was on This Week with George Stephanopoulos on Sunday, and Stephanopoulos was asking about Social Security reform. He said if he were president, everything would be on the table in Social Security reform. And Stephanopoulos said, so that means payroll tax increases are on the table as well. And McCain said, quote, there's nothing that's off the table. I have my positions and I'll articulate them, but nothing is off the table. I don't want tax increases. Of course, I'd like to have young Americans have some of their money put into an account with their name on it, but that doesn't mean that anything's off the table. Should John McCain take increasing payroll taxes either by the rate or by the income tax off the table?
I think so. I think that's the wrong way to go. That's the problem we have with Social Security is a number of them. Number one, we got to stop raiding the trust fund and spending all this money on other government programs. But also, you get a miserable rate of return the younger you are. At my age, I'm going to get about a 1% rate of return on my FICA taxes. My 3 kids, if Social Security could pay them their benefit, which right now it can't, they're going to get about a negative 1% rate of return. So I believe we had to harness the power of compound interest, let people actually own their Social Security benefit, so it's their property. They can grow it faster, they can get better benefits, and they can heir it to their children if they pass away. To me, harnessing the power of compound interest is the best way to improve the Social Security system. And what I'm proposing is a system just like what I have as a member of Congress and federal employees, the Thrift Savings Plan. It works much better than the Social Security system. We're basically saying, let's have a system run like that for Social Security, make it voluntary. Raising taxes on payroll is regressive. Raising taxes on payroll raises taxes on labor. And if you lift this cap, what you end up doing is having a massive tax increase on self-employed Americans in America. And we're having a huge growth in self-employed people. Raising taxes on self-employed people in this country is going to hurt job creation in America.
Isn't this precisely the same mistake that President Bush made when he went to reform Social Security?
I think they had the engineers running the marketing department in the White House when they sold this. I don't think they talked about the virtue of ownership, the virtue of building wealth, of building a nest egg, of ownership, of inheritability. And to me, these are the key principles that ought to drive fixing Social Security. Social Security ought to be a good deal for future Americans who are going to use it, not just the current Americans who are going to use it.
Before you came out with this plan, you and Senator Sununu put together a Social Security reform plan that, if I remember correctly, would have allowed workers to put up to 6 points of their payroll tax into one of these personal accounts. And the Social Security actuary said this would make the Social Security system solvent.
Yes.
Do you see any political prospect in the near future where Congress would actually enact a Social Security reform that gave people those sort of things?
I do not in this current Congress. The reason I'm putting this roadmap out there is to try and say, look, if we do these things, my bill has been scored as the actuaries is actually solving this fiscal crisis, making Social Security not only permanently solvent, but making it better for future generations. I think we need to do more to change the entire dynamic here in Washington so we can get these things done. Right now, nothing's getting done in Washington. We have total political gridlock and paralysis. And so I don't see the prospects very favorable right now. I'm trying to change those prospects.
Congressman, thank you very much for having us in to speak with you.
Thank you, Terry.